Welcome to the nursing and patient training video for the Smartez elastomeric infusion pump system. This video will introduce you to the Smartez elastomeric pump and familiarize you with the steps required to properly use this device for safe and accurate medication infusion. The Smartez disposable elastomeric pump infuses medication at a fixed flow rate using pressure from the balloon-like drug reservoir or ball against the fixed diameter taper of the administration tubing. The key components of the Smartez pump, as identified on this diagram, are the fill port, the soft outer cover, the multi-layered elastomeric membrane, the on-off clamp, the non-DHP, PVC administration tubing, the air and particulate filter, the flow restrictor, the patient connector, the patient end cap, the sterile color-coded fill port cap, the disposable protective port cap, the label indicating fill volume and infusion duration, and the label indicating flow rate. Please note, the disposable protective port cap will be discarded by the pharmacist after filling the pump, and will not be connected to the pump when it reaches the patient. Before working with the Smartez pump, make sure to prepare a clean, dry work area and properly wash and sanitize your hands. Gather the supplies needed to start the infusion, as directed by your healthcare provider or protocol. To begin the Smartez infusion, first clean the patient's vascular access site as directed by your healthcare provider. Next, verify that the clamp on the pump tubing is in the off or closed position, as pictured here. Then remove the patient end cap from the Smartez patient connector at the end of the pump tubing. Now, connect the Smartez pump by inserting the patient connector into the vascular access site, and turning the pump tubing clockwise to secure the connection. Make certain that the Smartez patient connector is tightened securely to the patient access site. Once the Smartez pump is connected to the access site, you may begin the infusion by opening the clamp on the pump tubing. It is recommended to move the clamp to a new section of tubing and inspect the tubing for kinks at the previously clamped section of tubing. If kinks are observed in the tubing, roll the tubing between your fingers to release the kink and ensure that the infusion can flow freely through the tubing. Patients should be advised to keep the Smartez pump connected for the prescribed duration of therapy. As the infusion progresses, the appearance, shape, and feel of the Smartez pump will change. For your reference, these images show the differences in the appearance of the Smartez pump when it is full, while it is infusing, and when it is empty. At the beginning of infusion, the inner membrane and soft outer cover will be taut, and the pump will be round and firm. During infusion, the inner membrane will decrease in size and the soft outer cover will begin to form wrinkles. At the end of the prescribed infusion time, the inner membrane will completely deflate, and the soft outer cover will collapse. Review the Smartez technical guide before using the pumps. Include these details in the patient education for Smartez pumps. Do not immerse the pump in water and protect the filter from getting wet. Avoid getting alcohol or detergents on the filter. Avoid sleeping on the pump and do not exert pressure on or play with the filled pump. Make sure the patient connector is securely connected to the access site. The Smartez pump should remain connected to the patient for the prescribed infusion duration. Because temperature can impact flow rate, advise patients to keep the section of the tubing from the filter to the patient connector under clothing and in contact with the body, avoid prolonged exposure to extreme hot and cold, and allow the pump to warm to room temperature before starting the infusion, if refrigerated. After the prescribed infusion time has elapsed, close the clamp on the pump tubing and then disconnect the pump from the vascular access site. Discard the empty pump as directed by your healthcare provider. Finally, flush the patient's vascular access site as directed by your healthcare provider. Contact your pharmacy with any questions. Thank you.